The Enduring Impact of Leaded Gasoline on Mental Health, a Historical and Public Health Perspective. Introduction. The introduction of leaded gasoline in the early 20th century marked a significant advancement in automotive technology, enhancing engine performance and efficiency. However, this innovation came with unforeseen and long-lasting consequences for public health. Despite early awareness of lead's toxicity, its widespread use in gasoline persisted for decades, driven by industrial interests and economic gains. Recent studies have illuminated the profound impact of lead exposure from automobile emissions on mental health, particularly among individuals born before the 1996 ban on leaded gasoline in the United States. This article delves into the historical context, health implications, and ongoing challenges associated with leaded gasoline, underscoring the critical need for continued public health interventions. Historical context, the rise and fall of leaded gasoline. In the 1920s, the automotive industry faced challenges with engine knocking, a phenomenon that reduced engine efficiency and performance. To address this issue, tetraethyl lead, TEL, was introduced as an effective anti-knock agent, leading to the widespread adoption of leaded gasoline. Despite existing knowledge of lead's detrimental health effects, the use of TEL became prevalent due to its cost-effectiveness and the substantial profits it generated for oil and automotive companies. Concerns about the health impacts of leaded gasoline emerged early on, with scientists like Alice Hamilton and Claire Patterson highlighting the potential dangers. Patterson, in particular, conducted extensive research revealing alarming increases in environmental lead levels, directly linking them to gasoline emissions. His advocacy faced significant resistance from industry stakeholders, but ultimately contributed to policy changes aimed at reducing lead exposure. The U.S. Environmental Protection Agency, EPA, initiated regulatory actions in the 1970s, culminating in the complete phase-out of leaded gasoline for on-road vehicles by 1996. blogs.cdc.gov Illinois Publishing Service +2 AnthonyTurton.com +2 CaliforniaCurated.com +2. Health implications, lead exposure and mental health. Lead is a potent neurotoxin with no safe level of exposure. It can disrupt brain development and function, leading to a spectrum of cognitive and behavioral issues. A recent study estimated that exposure to lead from car exhaust contributed to approximately 151 million cases of psychiatric disorders in the United States over a 75-year period. Individuals born before the 1996 ban experienced higher rates of depression, anxiety, attention deficit or hyperactivity disorder, ADHD, and other mental health challenges. Generation X, those born between the mid-1960s and early 1980s, were particularly affected, having been exposed during peak periods of leaded gasoline use. The study highlighted that more than half of the current U.S. population was exposed to concerning levels of lead during childhood, leading to long-term mental health challenges. Lead exposure during critical developmental periods has been linked to reduced IQ, behavioral problems, and an increased risk of psychiatric disorders. Corporate influence and public health advocacy. Despite the availability of safer alternatives like ethanol, corporate interests prioritize the use of TEL due to its profitability. This decision had far-reaching public health consequences, as the widespread adoption of leaded gasoline led to pervasive environmental contamination. Claire Patterson's groundbreaking research in the 1960s revealed a dramatic increase in environmental lead levels, correlating with the rise of industrial activities and the use of leaded gasoline. His findings underscored the extent of lead pollution and its potential impact on human health. Patterson's relentless advocacy, despite facing formidable opposition from powerful industry stakeholders, played a crucial role in raising awareness and prompting policy changes aimed at reducing lead exposure. Ongoing challenges and future directions. While the ban on leaded gasoline has led to significant reductions in blood lead levels, the legacy of lead exposure persists. Millions of individuals continue to live with the long-term effects of early exposure, including cognitive impairments and mental health challenges. Moreover, lead contamination remains a concern in other areas, such as old paint, plumbing systems, and certain industrial processes. Addressing these issues requires comprehensive strategies, including replacing aging lead pipes, remediating contaminated soils, and enforcing stringent regulations on lead use in industries. Public health initiatives must continue to focus on reducing lead exposure to prevent further harm and protect future generations. Conclusion. The history of leaded gasoline serves as a poignant reminder of the consequences of prioritizing industrial profits over public health. The widespread use of leaded gasoline has left an indelible mark on public health, contributing to millions of psychiatric disorders and cognitive impairments. Recognizing and addressing the ongoing challenges posed by lead contamination is essential. Through continued advocacy, policy reforms, and public awareness, we can mitigate the enduring effects of lead exposure and safeguard the well-being of future generations.